Today we have Dr. Tan with us, and I'm very happy to have her around because I really trust my face with her. I have not done any injectables yet, but all the laser treatments and all the advice that she gave me was really fantastic. And I'm just so glad that I have her today to share a lot more about the skin treatments that we have and to also like talk about certain problems that most of my clients face, and I hope that this is something useful for you as well. Recently on Arly, we actually put a post about like what a good makeup is. And I think for that post, it did quite well. And I thought that
Mm.
it's quite important for people to know what good makeup is. But even as a makeup artist, right, I feel that there are some things that makeup artists can't fix.
Really?
Yeah, that's the reason why we usually will ask our bridal clients to come
Mm.
for a trial session to make sure that like they know what they can work on with maybe a facial or maybe an aesthetic doctor on like what works for their skin. Yeah. So like for me, I feel like for makeup wise, fine line is very, very hard to fix. So for fine lines, what do you think we can do with it?
Yeah, definitely, because I think makeup is better for color correction and
Mm,
glow.
yes.
But things like texture,
Mm,
things like contouring, like
mm,
when there is too much hollows or when there is like too much sagging.
exactly.
Yeah.
It's true. It's true.
Yeah. So makeup doesn't do that part too well.
Yes.
So depending for like, if the texture, the rough texture is due to like dehydration,
Mm,
there are lots to do depending on the severity. Of
right.
course, using the right skincare is a great start,
Mm.
but we have extension of skincare, which is like medical grade facials.
Ooh.
So one of my favorites that is my go-to.
Yeah.
Every time before I have to do a video shoot, definitely I try to do that. Is actually the Aquafirm facial.
No wonder you look so good today.
Oh,
When
thank
I saw you, I'm
you.
like, do you actually have makeup on? You actually look so good.
Yeah, because
Yeah.
definitely a good hydration, good texture is going to help the makeup adhere much better,
Yes. Yes.
right? So definitely a hydrating facial. It's also a stem cell exosome based kind of facial. So it also helps with early signs of aging to
Hmm.
improve the elasticity, which
Hmm.
is also very important to help to ensure that the makeup adheres properly.
So can I just say that like with this facial, it actually helps to like plump up the skin. So if there's
Yes.
any like, like if the skin is not so firm, it actually helps to tighten it to make it look fuller.
Yes.
Ah,
In fact, it does more than plumping. The
right.
plumping is not just pure hydration. The plumping is also because with repeated treatment, it
Yeah.
actually promotes like collagen growth.
Ooh, that's what we want.
Yes, that's why the skin appears and feels smoother, firmer, and looks brighter.
So how long do we actually see like results based on this facial?
Well, for most people, I think for most brides, if they can give us 6 months,
Wow.
yeah, it will be a very good kind of time frame.
Right.
Whatever skin concerns or even like hair concerns they have.
Right.
But I tell a lot of the brides, ASAP is always the wisest kind of
Yes.
advice. So
Yes.
even if they can give us like 9 to 12 months, that means basically when they confirm their banquet kind of menu,
Yes.
sorry, the banquet venue,
Yes.
yeah, and they start to look at doing something, I
Mm.
think that would be perfect.
Wow. But
Yeah,
like these days, right, a lot of my clients they are quite last minute because everyone's so busy, right?
I
So what's like you
know.
think like still maybe still savable in a way? Like is it 3 months
Yeah,
or
I think 3 months, 3 months definitely we can do quite a bit,
mm,
because all the treatments that we do
mm,
is to improve, boost the repair and the
mm.
regenerative abilities of our skin,
Yes.
of our body. So
Yes.
we have to work and
Yes.
respect our body's biology.
Yes.
So for example, even if we do like therapy, or something more intensive like microneedle
Oh my god, I love
radiofrequency.
microneedling so
Like
much.
genius, right?
Yes,
Yeah.
yes.
So actually the best results come after 3 to 4 months.
Right.
Because you really need to give your body the time to build up that
Yes.
collagen, even though the treatment is very
I
effective.
actually really agree with that.
Yeah.
And also I feel that, a lot of us, or rather like a lot of my clients actually are looking into like injectables from the
Mm,
start, like the get-go. They
mm.
think that injectable is the way to go. So do you think that actually it's better to actually go for facial and micro needling? You also get that sort of like boosting effect.
Yeah, definitely overall,
Mm,
I feel that to protect
mm,
and to enhance the
mm,
body's regenerative ability,
mm,
to improve the skin's biology
mm.
wherever possible is definitely a great first step, right? But
Yes,
of course,
yes,
there are certain times where we cannot, for example, where the, the bone structure is like too flat.
yeah,
That's why we are having the sunkenness and the hollowness.
yes,
Well, we are born this way,
yeah,
so to enhance that, we will have to use like injectables, like, a
right,
touch of filler and all that,
right,
to improve and to lift the
nice.
under eye.
But is there any like procedures or rather like any facials or lasers that you can do without injecting to boost and to brighten the under eyes as well?
Also many, even in a very small area like the under eye,
Mm.
you know most people will come to us, complaining about their tired eyes, dark
Yes,
eye
all the
circles,
time, all the time.
eye bags and all that,
Yes,
but a lot of times what they complain of might be due to different things.
right.
So a simple self check I
Mm,
always tell the patients
mm,
is, which I use in the
mm,
clinic,
mm.
is basically the
Oh, the pull. Okay,
pull,
pull,
push,
push,
and then pinch.
pinch.
Okay,
Okay,
so it's a three-step test.
okay,
So if it's a dark eye circle
right,
due to, let's say, vascular, that means you have broken capillaries in the under
right,
eye,
right.
or due to pigmentation in the under eye,
Mm,
when you pull, you will
mm.
see that the discoloration follows you.
Oh,
Yeah.
wow, this is
So
fun.
so if it's a discoloration,
Right.
then you would need, let's say, if it's a pigmentation, you will need like a laser
Okay,
to reduce the pigmentation.
okay.
Now, often that pigmentation might be due to, like,
Rubbing of
rubbing.
eyes, yes.
Yeah, then the bad habit has to stop lah.
Okay,
Yeah, or else it will
okay.
come back, right?
So it causes like broken capillaries from rubbing eyes.
Yeah, but rubbing the eyes, yeah,
Wow.
sometimes, we are in too much of a hurry at the end of the day to remove
Yep.
our makeup. So people can be quite rough, yeah.
I know. I absolutely know how you feel about it. Some of
Yeah,
my clients does that.
gentle,
We
gentle,
are
treat it
all
like
only
baby.
human.
Yeah, like baby skin. Yeah. So
Yes.
sometimes, also with like aging or sun damage, the skin thins, and then
Yes.
we get like broken capillary on the
Yeah.
eyes as well. So depend on how severe the broken capillary, there
Mm.
might be, laser treatments to target the broken capillaries. But a
Mm.
lot of times we also need like either laser treatments or phase to build up, the
Right.
skin and the muscle tone again,
Oh,
so
nice.
that the whole under eye will look rested and radiant.
Right.
Yeah.
I feel like in terms of like concealing under eyes, I think
Mm,
in terms of like the current technology we have in
mm,
makeup is pretty good to actually kind of like conceal maybe dark
mm.
eye circles. But if we are talking about like sunkenness, like it
Yeah.
sunks in, or
Yeah.
like you have like fine lines, I think all
Yeah.
these are things that I always tell my client that makeup can only bring you this far. And
Yes.
then that's when like aesthetic has to step in, and that's the reason why I feel like it's good to share with like more people about like what procedures there is in the market and like what
Yeah.
can be done.
Actually, there are
Yeah.
many things that can be done besides surgery,
Yeah. Yeah.
So that's where the push comes in.
Yes.
A lot of people, they say that they have dark eye circles,
Yes.
but really it's like a hollowness. So when you
Yes.
push, you
Yes.
can see that compared to the other eye,
Yeah.
suddenly the whole eye looks lifted,
Oh wow. Yeah.
and
Yeah.
then it
Yeah.
looks
You're right.
brighter.
Yes.
Then that would tell you that it is actually due to a hollowness.
Right.
And the degree that you have to push
Mm.
will tell us how much volume you
True.
might need lah.
Yeah.
It's
I mean, we can
estimated.
highlight to a certain extent, but
Yeah.
anything more, I think definitely kind of difficult for sure.
Yeah, because
Yes.
I mean, makeup is color correction, so
Yes.
the brightness will bring forth, and
Yes.
the darkness will recede.
Yes.
Is to mimic the natural way that the
Yes. It's
light
like
will
reflecting
hit.
lights.
Yeah,
Yes.
yeah.
Yes.
But really, when the hollowness is more significant, we
Mm.
have to look at really restoring the
Mm.
structure and the support.
Mm.
So this, if it's very mild,
Mm.
if it's very mild, like mild sunkenness, like a mild teardrop,
Right.
then even things, regenerative skin boosters,
Right.
one of my favorites is like Regenerant,
Visual.
would be a great choice.
Right.
Yeah, because a lot of times the aging starts
Yes.
around the eye. So yeah,
Yes. Yes,
we start
totally.
to see it.
We always want to lift
Yeah,
our eyes.
yeah.
Yeah.
We start to see it even in like young ladies,
Yeah.
in like their late 20s
Mm.
or their early 30s. Yeah, so it's something that is very common. So if it's mild due
Yeah.
to very early kind of fat loss,
Mm.
yeah, in the under eye,
Mm.
in young ladies, then even like Rejuven as a skin booster would be a great start.
But with the sunkenness, does it, how about like dark circles? Will it actually help as well?
Yeah, because when
Yes.
it's very hollow, you are actually seeing the concavity, so you're looking at
Mm.
a shadow, and that
Right.
shadow is the one that is casting the darkness.
Ah.
So the eyes always look tired. Yeah.
Yes.
So
Yeah.
if the dark eye circles, you push, you
Mm-hmm.
mimic volume, right? You
Mm.
mimic volume, and it looks so much better, and the
Mm.
eyes look more lifted. Then what you are dealing with
Mm.
is actually mainly hollowness.
Mm.
Of course, in cases like I mentioned previously, if it's
Mm.
a bone structure kind of
Yeah.
problem, then we are unable to regenerate because it's
Yeah.
something that we are born with. So
Yes.
then, in that case, then we will have to use a touch of filler.
Right. Like a
Hmm.
little bit of injectables. How about the
Yeah.
pinching thing?
Ah,
Yes.
pinching gives us information about the skin elasticity.
Oh, so it's like is it like bouncy?
Yeah,
Is
because
it,
when we are young, it's supposed
yeah.
to spring back, right?
Right,
That is
right. Oh,
elasticity.
okay. But how
Yeah,
do we, I mean, honestly, as we age, we will think that, oh, it's actually bouncy, but maybe it's not bouncy. So
yeah.
how do we know what kind of bounce we are looking
Or
at?
you will see. You just pinch a younger colleague.
Okay.
Oh, that
I
was so
think I was like,
cute.
oh, so
It's like it's
cute.
like immediate and the feel and the
Right.
feel,
Wow, I'm
right?
going to do this every day, like a self check.
Yeah, no, no, no,
Like,
no,
am I
don't.
bouncing? Then what if I bounced one lump? Like
Yeah,
squeeze one
yeah.
lump? That's quite
If
funny.
it doesn't rebound, if the rebound
Oh my
is
god.
very slow, it gets tented. Then we definitely need a collagen boost.
Okay, so talking about collagen, this is a
Yeah.
very interesting topic. So
Yes.
basically, a lot of my clients before their wedding day, or rather like the whole
Mm,
prepping journey, right? They will tell me that they want to drink collagen.
mm,
They will ask me recommend like drinking collagen. But I
yes.
think I ever read a study before that when you ingest collagen, you don't actually produce collagen on your face. So like what would be a recommendation to boost collagen on the face instead of just ingesting collagen?
Well, ingesting is nutrition is definitely important,
Right.
but we also prescribe collagen supplements for that
Mm.
matter. But the studies for one successful product
Mm.
doesn't translate to another product.
Wow, I love this truth.
Yeah,
Yes.
yeah. So you cannot just like migrate over.
Mm.
So that study that is done for that product is only true for that product. So that
Mm.
there are good collagen supplements, because a lot of time, truth be told, nowadays when we take protein, we are not taking the skin. We are not taking the
Yes.
tendons. We don't take kway
Yeah.
chap all the time. We worry about our
Oh, but I
cholesterol.
love though. I love 猪脚醋.
Yeah, yeah, yeah,
Like pork trotter vinegar. It's like my
yeah.
favorite.
That is
Yeah.
collagen plus plus, right?
Oh, great. So I'm actually taking collagen. Okay,
Yeah,
good.
but it's not so great for the waistline and the
Okay.
cholesterol. So
Okay.
we don't take enough,
Right.
right? Versus previously we used to eat from nose to tail.
Right. Right.
Yeah. So
Yes.
nowadays we are eating more lean muscle meat.
Mm.
So sometimes we do need collagen supplements, especially when we are doing collagen boosting treatments, because the boosting treatments, like your our therapy, soft wave, or even the genius lift,
Mm.
is like exercise, is akin to exercise. When
Mm.
you want to grow a certain tissue like your
Mm.
muscle, you have to activate it. So
Mm.
the first thing when you want to do muscle is to go to the gym, right?
Mm.
You have to
Yes.
activate. So
Yes.
in the skin world, the
Mm.
collagen, to grow collagen, we need to activate that growth.
Right.
So we do all these energy based collagen stimulating kind of devices
Right.
to activate that growth. But
Right.
once you activate that growth after your exercise, your PT is going to ask you, now Aileen, I want you to go and take the protein shake, or you
Yes.
take the beef steak, yeah, because
Yes.
you need that nutrient, you need that
Nutrients.
building block
Mm.
to allow your body to build
Mm.
properly. So
Mm.
if in our normal diet we are not
Mm.
taking enough,
Mm.
then at that point of time, then the collagen supplement would be actually quite a good idea.
Okay.
Ah.
So now today we demyth something pretty good.
Yeah, so they
Yeah.
are all good, yeah, but you must look for a good product. And I think the most important thing is it needs to be safe.
Right.
It
Absolutely.
needs to be safe
Yeah.
because safety is number one. It's like when we look for a safe treatment,
Yeah.
yeah, that is going to have very good safety profile. That means
Yeah.
your risk is very low, but your yield is
Right.
high. So
Yes.
that in my mind is a great treatment,
Yeah. I
right?
always believe in like finding the trusted source to
Yes.
get the right things done.
Yeah.
Yeah. By
So
a professional.
same for the
Yes.
supplement. You need to make sure that it is safe. Yeah,
Yes.
because a lot of the skin collagen
Mm.
supplements,
Mm.
they are marine based, and we know now all the seas are polluted
Yeah.
and all.
Yeah.
So safety is to
Yes.
make sure that it is safe for consumption.
Yeah.
Ah,
Yeah.
yeah, I think that is more important to bear in mind.
That's very mindful. Yeah, we have
Yes.
to be very mindful about that
Yeah.
as well.
Yes.
Yeah. So like after like usually after dark circles, I think another question a lot of my client will ask me is that, hey, can I have like glowy, clear skin, like like flawless? In my previous post, I did say that like there's no way you can get poreless and flawless um in real life because we all are like just only humans. We have a little bit of like skin texture, just a
Mm,
bit, like a bit of pigmentation and things like that.
yeah, but it's beautiful.
Right? Yeah. So I always
It
encourage that.
proves that we are alive.
Exactly. So I always encourage that, but also I have also clients who have really severe like dark spots or pigmentation.
Yeah.
I think I think for them they are very clueless on like what sort of like laser treatments or what sort of things they can do for their skin.
Yeah, actually, dark spots, yeah,
Mm,
pigmentation, hyperpigmentation is
yes.
the number one sign of aging in
Right.
our Asian skin. It's just like
Right.
for Caucasians,
Yes.
when they age or when they get sun damage, they get like deep wrinkles, right?
Yes.
So
Deep
for
wrinkles.
Asians, yeah, we get like
So
pigmentation.
we look like a aged banana.
Oh
Right?
no!
Very, very brown.
Yeah, we tend to get, at first we look dull. Yeah,
Yeah.
yeah, right.
You're
So
a bit
that is,
dull, right?
yeah, that
Yes.
is one of the first signs of aging,
Mm.
because really when we do the skin scanning, yeah,
Yeah.
we look underneath the skin, even when you don't see spots on the surface, you just like feel like your skin is a little bit dull. When you do the
Yes.
detailed skin scanning, you already see lots of pigmentation
Yeah, it was
underneath.
horrific, man. Mine. I look at it, I'm like, am I gonna age like that? It's kind of scary.
Yeah, so
Yeah.
you know, as with like wrinkles and all, we know that when it is very etched in,
Mm.
that means some of the damage is permanent. So this
Right.
is this is where the basic concept where prevention is better than cure, early treatment is better than late lah.
But is it reversible? Like, if it's already there, is there any way we can just,
Yes, there is.
blast it
Yeah,
away?
there is definitely something, a lot of things actually that we can do
Mm.
to try and repair the damage. Like I say, most of the regenerative treatment
Mm.
is to boost the capabilities, because when the
Mm.
skin get damaged,
Yeah.
then naturally the repair abilities will drop.
Yeah.
That's why we
Totally
age, right?
true. Yes.
So we can do treatments to boost that repair.
Mm.
Yeah, so the earlier it is,
Mm.
yeah, the better it will be. So whether you're concerned about dark spots or enlarging pores, they are all different signs of damage.
Right.
Or fine lines, yeah, all different
Right.
signs of damage. When you boost the skin's innate repair
Mm.
abilities
Mm.
and you get healthier, aka better looking skin,
Yeah.
actually everything improves.
Okay.
Yeah, and then of course there will be like those treatment, like pigment laser, like
Yes.
pico
Yes.
laser,
Because like a common thing.
yeah,
It's as common. Yeah.
where you can target the individual spots lah,
Mm.
to break it up so that the body is able to clear it better.
But like other than pico, is there other things as well?
Yeah,
Like any other
yeah,
lasers?
like I say, usually as a base, we
Yeah.
tend to veer towards more repair. You know,
Repair.
overall repair together with targeted blemish treatment.
Mm.
Yeah, because
Mm.
otherwise it's just again cosmetic.
Yeah, it's true.
It's again cosmetic.
Yeah.
You know, the good thing is when you repair the whole skin that was damaged,
Yeah.
you improve the physiology.
Yeah.
So it does not only look younger,
Mm.
it is actually younger.
Right. So another thing I want to ask is that, like since like people have like hyperpigmentations, and of
Right.
course in the market there's a lot of like dark spot treatment
Yeah.
serums. There's like different kinds of ingredients that is probably good for brightening the skin.
Right.
Um, I remember I actually went to your clinic and you customized the serum for me before,
Yeah.
and I loved it because it really did give me a brightened complexion.
Oh, I'm so glad.
Um, and inside I think there was niacinamide in it.
Yeah.
So, like, does niacinamide actually really help to like brighten the skin?
Yes, it does. You know, it's like nutrition for the
Mm.
skin. So I always tell my patients there's three basic way you nourish your
Yes.
skin. One you
Okay.
eat, of course. The other one you apply,
Yes.
right? So
Yes.
we know vitamin B's are very important, right?
Yes.
So we can apply it.
Mm-hmm.
And we know when we apply it to the skin, there is a few very important functions of the niacinamide, which is vitamin B3,
Yep.
that it does for the skin and the body.
Yep.
So number one, it reduces the transfer of
Mm.
pigmentation to the surface skin, which
Right.
is why it brightens.
Mm.
And if the pigmentation is mild,
Mm.
it gently lightens.
Oh, nice.
Okay, all
Right.
right. So that is one. But what niacinamide actually does, very importantly for the skin, is that it's
Yes.
basically a cell energizer. You know, for
Ooh.
example, like now, this is very trendy. You know, I have a lot of patients. You know, all different kind of age groups. Even when they're young, you know, they will ask me about NAD. Right, but NAD is a form of vitamin B3, like
Yeah.
when we eat from the food, like the
Yes.
niacinamide, when we eat and the body produces.
Yes. Yes.
So it's the same thing when you apply to the skin, it
Yes.
helps with the energy production.
Right.
Everything requires energy.
Yes.
All
True.
right, repair, regeneration, turnover, everything
Yeah.
requires energy. To
Right.
recover from the laser, it
Yes.
requires energy. And the better your skin recovers from your
Yes.
treatment, it means you have no downtime.
Mm-hmm.
Okay, it means that you have better results.
So means skincare is very important
It
as
is very
well.
important. You know,
Yeah.
it's like what I said, you know, the treatment and
Yes.
then, you know, the nourishment.
Yes. Like hand in hand.
It's hand in hand. There is no one that is more important. Of course, if you just apply the skincare,
Mm-hmm.
very unlikely
Mm.
that the obvious dark spots is going to go away.
So means like stubborn dark
Yes,
spots is definitely we need
some form
um
of treatment.
some sort of treatment.
Yeah, so for
Yes.
example, like the brighten tone is very popular. So
Right.
that combines the silver max where we do, you know, overall repair work.
Yes.
Okay, then followed by, you know, the laser,
Yeah.
like the pico laser, you know, to target the
Right.
blemishes.
So Pico is for targeting, and then the tone and brighten is to repair
Yeah,
the
more,
skin.
more,
Right.
more to
Because
repair the
I
skin.
always believe like how I always share with my clients, like in the day it's all about protection,
Yes,
and night is about rejuvenation. Yeah,
regeneration. Yes,
regeneration.
yeah,
So it's like repairing your skin. So like a laser itself can also helps with repairing as well.
definitely. It's a great point. It's what we call
Yes.
chronobiology.
Wow,
That's
love that.
why it's all about working with your biology,
Mm.
respecting your biology. There is
Mm.
no point fighting the biology because
Yes.
that's not how it works.
Right.
Yeah. So we
Yes.
have to understand the biology and then we
Yes.
work with the biology and we have tools, you know, like treatments, like
Yes.
skin boosters to enhance that ability.
Yes.
Ah,
Yeah. And then
that's why
also
it takes time.
it's true. And then also like I realized that a lot of them, a lot of my clients, they actually have issues with vitamin C these days.
Mm,
So they say that they actually break out from it. They feel like
yeah.
it's very oily. What's your take on vitamin C?
Wow, I love vitamin C, you know. What are vitamins?
Mm.
Vitamins means it's something that your body needs,
Right,
that it
vitamins.
cannot produce.
Mm.
So it's vital for function and life,
Oh,
right? So
right.
all vitamins are good, but how much you need, what form you need, you know.
Yes.
Ah, that depends, you know.
Mm.
That's why, for example, like you're saying, the customized skincare, before we customize, we actually do a AI scan,
Yeah, I really love that. That was fantastic.
right? Because
Yes.
not everybody does well with the most potent form. Because when we say vitamin C, usually we are talking about L-ascorbic acid,
Yeah,
which is the most potent form of the vitamin C. It doesn't always mean that
it's the best.
stronger is better.
True.
What your skin responds and can accept
Mm.
is the best for you.
Wow.
Yeah. So
Right.
when it's too much, because we know L-ascorbic acid is very acidic in pH. So
It
in
is.
yeah, in fact, you know, for a good L-ascorbic acid, you know, the pH is probably like 2 point something. It's like your vinegar.
Wow, this was a little bit warming. Like
Yeah.
it's a bit hot on the skin as
Yeah.
well.
Because then it will exfoliate your skin. So if
Mm.
your skin is already dry, if it's
Mm-hmm.
already sensitive, then
Mm.
it might not be the time
Right.
to apply the L-ascorbic acid. But fear not, you can always eat. Yeah, make sure you take a lot of fruits and
Right. So
vegetables. And
ingesting it
yeah,
actually really helps.
yes, you know, so you don't
Yes.
have to apply everything that the TikTok influencer tell you is very important to apply.
Coming
You know,
from a
right?
doctor.
Or like even like doctors on the TikTok ask you to apply. You know, because it might work for many people, but if it doesn't work for you, it doesn't work for you.
Yeah, I feel like with when it comes to like skincare and treatments, or even as well as like makeup, like the general rule of thumb is like on TikTok or on social media is usually more of like generally for masses how
Yes.
this work. But when
Yeah.
you actually really hire a professional, like be a doctor or myself as a makeup artist,
Right.
I think we are able to really cater to what suits you instead,
Yes.
what you actually need.
Yeah.
Yeah, because it's no longer a buffet when it comes to us. It's actually a homemade, like home cooked meal for you,
Yes.
right? Customized.
That's targeted to you.
Yes.
Otherwise, you know, when you over
Yes.
irritate the skin, you cause inflammation,
Yes.
and then you get breakouts.
Yes, because like these days, even like when it comes to like complexion products in the
Mm.
market, a lot of products nowadays are more of like to soothe the skin, to calm the skin down. So we don't see so much of like vitamin C in it anymore. We see a lot of like niacinamide in it to help to like brighten and to calm the skin. That's the reason why like nowadays when it comes to like complexion products, um, it feels nice on the skin.
Yes.
Yeah.
I I think it's, you know, it's like fashion.
Yes.
Everything goes in a cycle, yeah.
Yeah.
Previously it's all about the actives, and the stronger is better.
Yeah.
You know, which is why people get breakouts, they get inflammation, they get irritation, they get
Yes.
flaking, and after that then comes the, you know, the for the sensitive skin, you know, to
Yes.
calm and to hydrate and everything. But beware, you know, because you know it's not about how much hydration you put, is whether
Yes.
does your skin need that
Yeah,
hydration.
true.
So definitely too much hydration is not great either. You know, you
Yeah.
can cause clogging, you can cause breakouts
Yes.
and all these
Yes.
things. You know, then you will come back to the actives, right?
Yes.
That's why, like Irene says, you know, sometimes when it's the general thing,
Yeah.
the general good advice, if it doesn't work for you, then I think it's time to look for Irene for the
Yes.
you know.
Yes,
uh,
yes, it's true, it's true.
then we can look into why and what, you know. And it's important for I love it when the patients actually communicate this with me, because it's very
Yes.
important for me to understand their reaction to, you know, various things that they have applied previously, because
Yes.
it will give me a huge clue.
Yes.
So the I think, to sum up, the most important rule in health, whether for overall health or for skin health, I tell people, is the Goldilocks rule.
Ooh.
Not too little, not too much. If you
Mm.
don't have enough vitamins, it's, it's not going to work,
Yeah.
right?
Yeah.
Yeah,
Absolutely.
when you have deficiency, definitely the skin is not going to be healthy.
Yeah, for sure.
Okay, but when you oversoothe and you overhydrate and you overfeed, right? It's like,
Yeah.
then we get fat, right? You know,
Yes, yes.
then it's also no good.
Causes more problems.
Yeah, so
Yeah.
it's not too little and not too much. Of course, that sweet spot is different for different people, and
Mm.
that sweet spot often changes as
Mm.
we go through different stages of our life. So the thing is to always find that balance
Mm.
again.
Wow, nice.
Yeah.
I absolutely agree with that.
Mm.
Yeah, because I also feel that when it comes to like our own health, especially like when it comes to our complexion, tone, like how do we look, it's actually a lot to do with like your health. And of
Yes.
course, like a lot of us would definitely want to like improvise that to prove to people that hey, I'm actually healthy. Like generally everyone comes to us is to look slightly better because they want to look slightly more approachable
Healthier.
and
Yeah.
healthier.
Yes.
Yeah. So yeah, I think it's good to actually come for a consultation once
Yeah.
in a while, right? Just to
Absolute.
check, like a check.
Absolutely.
Like
Yeah.
how you go for a health check, I think it's good to also go to a doctor to like check on your skin health, what
Yeah.
can you improve, and then from there on, I think based on like the complexion and the way the person is, you can actually tell them, oh, maybe you lack a little bit of these minerals, or maybe you need this vitamin.
Yes.
Then from there on, when you improvise and then you add a bit of like skincare and a bit of like the natural makeup, it actually does make you feel better about yourself.
Oh, definitely. Makeup
Yes.
enhances everybody.
True.
Yeah.
I agree with that.
Yeah, but
Yes.
definitely I think it would be better if it was built on a great foundation, like a good
That's
canvas.
100%. Yeah,
Right? Like an artist. Yeah,
I
you want a
always
good
believe
canvas.
in
Yeah.
good like good skin first.
Yes.
Yeah, good skin over more makeup.
Yeah,
Yeah.
that is wise.
Yes.
Yeah, that is
Yeah.
definitely very wise advice lah. Yeah.
Yes.